I treat trauma-based disorders like PTSD, depression, anxiety, substance abuse, and relationship and couples counseling. So in a typical counseling session, you would come in, we'd have a 60-minute evaluation. After that evaluation, we come up with some measurable goals to work on. We'll write a treatment plan, and we figure out exactly what you want to achieve out of coming to counseling. Based on how you respond to that, we'll gauge your progress over a couple months. To some people can come for a couple years, but usually for a couple months. Once we decide that you've made enough progress, then we decide and we work on discharge. The first session is an assessment. During that assessment, I'll ask you a number of questions. Based on how you answer those questions, we'll decide how to move forward from there. I want to determine if there's any substance abuse problems, if there's depression, anxiety, or trauma, and depending on which issue it is, that's the one we decide to work on. After the evaluation, we do 45 to 60-minute sessions after that. Some people come weekly, some people come every other week. It just depends on the severity of the symptoms. After coming for a while, sometimes we'll go back to once a month and then periodic booster sessions after that. Choices has a very private feel compared to some of the larger facilities. The waiting rooms aren't big. There's not a whole pile of people in the waiting room. You come in, you're just talking to me. Questions can be directed to me. I'm the go-to guy, so the buck stops here. If you know any questions, like I said, people just ask me. They don't have to call to a secretary and deal with the office staff. It's very private, and it's very confidential too, because I'm the only one that's going to be hearing what you're saying, and that's about it. Nobody else hears it. Some other places do. It's called treatment team meetings, where they have a whole group of counselors and they all talk. And while that can be effective in some ways clinically, I don't know that it's as confidential as it could be. We set up goals when you first come in, and say if it's depression, we'll rate your depression from 0 to 10. 10's bad, 0's good. When you first come in, you may be at around an 8. I'll ask you periodically throughout treatment where you're at from 0 to 10. It's fairly simple. We identify what the depression symptoms are, how bad they are. So if you're an 8 or 9 when you come in and you're a 3, then it's gotten better. That's how we determine. It's hard to rate that because it's subjective, and that's what depression and anxiety are. They're subjective. They're how you feel. So we rate that, and if our goal would be just get your depression to a 3, when you hit a 3, you're done. I try to see I like people to a 0. I want to get them done so they don't have to go anywhere else and they don't need therapy anymore. But it doesn't always get there. It's kind of an imperfect process, and we just have to adjust it based on what the person needs. If it's trauma-based stuff, there's a certain way to do that where we rate the traumatic memories from 0 to 10. 10's bad, 0's good. Try to 0 them all out or get them at least good enough. Usually people report to me that they're just feeling better and they say, I'm feeling good. We could probably cut the sessions back, so we'll go from weekly to bi-weekly. And then when they're feeling even better, we go from bi-weekly to once a month, and then booster sessions as needed. But more often than not, people come in, they say thanks, they said it was helpful, and they said they think that they're done. And I say, great. We come up with a plan so they can call me. I have people call in back that have been in therapy with me. They did maybe a 4-month therapy session group, and then they'll call me, and then they'll come back in for a couple more, and then they'll say they're done again, and then they go live their lives. And I think that's a good way to do it because they know the door's always open, that it's not just like you're gone and you're done. If you need something, they send me emails. I've had texts from clients and calls and emails and everything, and I just answer a question and they decide if they want to come back or not. And then we set up with a good aftercare plan so they know what to do when they leave. We're well prepared for it. You start planning for that as soon as they walk in the door. I start planning for how am I going to get them done so they don't need to come anymore. And some people just reach out and just say, I'm still doing good, and that's great. So how do you decide what counselor you want to see? It's different for everybody. At this point, most people go online and they Google and they find a list of counselors. They read their profiles, they look at them. They think, could I go into a room and talk to this person about some of the stuff that's bothering me? The answer is yes, they give a call. A lot of people that call me, I think they call a lot of other counselors in the area too. So they'll make a lot of contacts. And based on how, me as a counselor or some other people as counselors, we just answer the questions honestly. And then they decide where they want to go. Some people look at what your specific skill sets are. Mine, a lot of trauma, depression work, anxiety work. So people with more severe trauma type issues tend to gravitate towards me because I have that training and skill set. Trauma is very difficult to work with. So other counselors, if you're not really certified or trained in it as well, some tend to stay away from it. Substance abuse is another thing some people are a little uncomfortable with because it's very complicated and there's a lot of issues that go into substance abuse. So some people don't want to work with substance abuse. Some people don't want to work with trauma. Some people don't like doing relationship counseling. I do all that stuff and I've been doing it for a lot of years now, so I feel pretty comfortable in whatever situation I'm in. So when people are looking for a counselor, they look at their skills, their personality. When they come into the session, they talk to me. This is basically how I am. So my personality works with a lot of people, so we try to we just go with that. But everybody has a different method for picking a counselor, and I hope you pick me. I love seeing people get better. You can see them change. You can see sort of like their eyes clear up. People coming out of a really bad depression, it's just, you can just see it go across their face whenever they start to feel better. And they start to notice it. And then when they start noticing it, their behaviors and actions change. Sometimes they'll start putting out resumes to get a job and to get back to work. And some people that are working, their productivity at work tends to increase. People with anxiety, they can leave the house, they can get out and do things. They don't feel trapped in their house. They don't feel like if they leave, something bad's going to happen. So, yeah, I like seeing people get better. That's what I'm here for.